This is actually our 25th anniversary. We're very excited. We have a database now among our 6 clinics of over 90,000 scans on people from 111 countries. So we started in Fairfield, if you can imagine that, but it's perfect. It's halfway between San Francisco and Sacramento. It's at the intersection of 3 large freeways. It was a cool place. But we're happy to be here, happy you are here. We're going to talk about the work we do with ADD, which is, probably 50% of the patients that we've seen over the years have ADD of one form or another. We see a lot of other things, Alzheimer's disease and autism and bipolar disorder and depression. But because I'm a child psychiatrist, half the people I saw initially had ADD. So we developed this really wonderful expertise in this disorder that devastates people's lives, and it's still largely sort of disrespected. But when you think about it, when ADD is left untreated, almost a third of people with it never finish high school. So that one sort of symbol of success, a third of them don't do. 52%, according to one study from Harvard, will abuse drugs or alcohol in their life. There's a higher incidence of obesity. It triples the risk of obesity. Now, why do you think that might be? I'm sorry? Impulse control issues. And everywhere you go, people are trying to shove bad food down your throat to make money off of you. And you need to have fairly good impulse control to be able to survive Jack in the Box, right? Who wants to reach out and poison you. Depression is very high. And depression really comes, I think, from this concept called learned helplessness. Is with ADD, you try and it doesn't work, you try and it doesn't work, you try and it doesn't work, and then you say to hell with it and you stop trying. It's associated with job failure, divorce, incarceration, and I knew this before the studies came out. It's associated with Alzheimer's disease. Why? Because it's associated with many of the risk factors associated with Alzheimer's disease, including diabetes and heart disease, obesity, head trauma. And who gets head trauma? It's often the people who have ADD that run out into the street without forethought or without looking. Now, I like to start most lectures on ADD talking about their strengths, because people with ADD have a lot of strengths. In fact, in 1996, Time magazine said that President Clinton was only a pill away from greatness. And they meant Ritalin, because he couldn't pay attention, he wasn't on time, and he had all sorts of issues with impulse control. But people with ADD are often highly intelligent, creative, spontaneous, successful. Edison was thought to be ADD. Michael Phelps was formally diagnosed with it, took medication for it, and in 6th grade he decided he didn't want to take medication, so he did the natural form of treatment for ADD, which is intense aerobic exercise. But when, after Beijing, he didn't exercise, he took a couple of months off, he got himself into all sorts of trouble by smoking pot, and everywhere you go somebody's got their phone on you, or of course the NSA is listening to you. The NSA is making it really hard to be a psychiatrist these days, because if you come in and you act paranoid, you may be right that they're listening to your conversations. Terry Bradshaw has said that he has ADD publicly, as had Justin Timberlake. They think outside of the box, and many CEOs have ADD. In fact, that's actually known among CEO coaching groups. People who have ADD are those people who run toward fires because they're often excitement-seeking, drama-driven with low frontal lobe activities. We'll see they're looking for ways to turn themselves on, as opposed to people like me, we run away from fires. I'm like, it's hot. Aren't you thinking about that? There are many myths associated with ADD, such as it's a fad. Oh, it's new. Well, no, it's not. It's actually described over 110 years ago by George Still, who's a pediatrician in 1903, who actually said that there's a whole group of kids, hyperactive, restless, impulsive, can't concentrate, and he called them constitutionally incorrigible. Yeah. I mean, it is constitutional in that it's biological, it's often genetic, but they're not incorrigible. There's another myth is ADD is overdiagnosed, and that may be true, because in fact it may not be ADD. It may be you're allergic to milk or to wheat, or you have Lyme disease, or your parents are about ready to get divorced, and the chronic stress will make you look like you can't concentrate. But I still think it's underdiagnosed in girls. I had a great example of a girl today, bright, but can't really focus. And so people tell her to try harder, try harder. If only you tried harder, you would do better. And when we scanned her, she had low activity in the front part of her brain. The harder she tries, the worse it gets. And it's underdiagnosed in non-hyperactive, introverted males. ADD is increasing in the population. If you talk to teachers 40 years ago, they'd say they had 1 or 2 of these kids in their classroom. Now they'll tell you they have 8 of them. It has increased 400% since 1990, according to the CDC. And some of the reasons for that is we're limiting PE in schools. There's the excessive use of video games. We're being exposed to more toxins with plastics and pesticides than ever before, processed foods. And this limiting PE is really interesting because there's a part of the brain, I'll point it out as we go along, called the cerebellum in the back bottom part of the brain. It's involved with motor coordination. We've known that for a long time. But now we realize it's also involved with thought coordination, how quickly you can integrate new information. And if you do not physically develop and stay active and do a lot of coordination exercises, you can't think right. And one of the best examples I've seen recently is I have a granddaughter that has a seizure disorder, and she's developmentally delayed. And one of the best things for her, so first they put her on the ketogenic diet, her seizures went away. So it's basically taking out all carbohydrates in your diet, and literally for the last 2 years she's not had a seizure. But her development skyrocketed when they put her on a horse. And I'm thinking, now why is that? But when I went to horse therapy with her, when she's, even at 2 years old, sitting on a horse, you have to fire your cerebellum because there's so many things you have to balance at the same time. And so now I really understand why horse therapy is good for autistic spectrum kids. ADD, of course, runs in families. Anybody who's read my work on ADD knows that I have several children that have it. Of course, they got it from their mother, not me. Although I do have an hyperactive older brother who used to beat me up every day of my life until I was about 7 and could hit back. But, of course, they got it from their mother. Anyways, this is Caitlin. Caitlin, when she was 7, this is her first communion, her hands on her hips. She was born that way. And she just had my grandson, Liam. And he so reminds me of his mother. In fact, she called me up one night crying. She goes, "I got the kid I deserve." He's really cute. So what causes it? I mean, it runs in families. Yes, you do get it from your mother or from your father. But But also, if you hit your forehead, which is why I am totally opposed to soccer headers for kids, completely opposed. Your brain is soft, about the consistency of soft butter. Your skull is really, really hard and has many sharp, bony ridges. Why would you ever let a child hit a soccer ball with their head, or put their head in a helmet and start slamming it up against other people? Helmets don't protect you from brain damage. They protect you from skull fractures. But inside your brain, consistency of soft butter, housed in a really hard skull, hit the soccer ball with your head or crash into someone playing football. This is what happens to your brain inside your skull, because it's not anchored. It basically floats in water. Food allergies, especially to milk and corn and dairy, wheat, lead exposure, oxygen deprivation. So if you were born with the cord wrapped around your neck and you were blue, or you had a near drowning episode, or there's this crazy thing called autoerotic asphyxiation. I think it was David Carradine died that way. Or this new really crazy thing that's happening. It was highlighted in the movie Maverick, where kids are seeing how long they can hold their breath underwater. And there were actually a number of drownings last year because they realized they could hold it forever. Infections, I think, don't you think, Ken? This is like a huge, relatively new issue, that Lyme disease is actually becoming epidemic. And one of the very scary things that we just learned, or at least I just learned, is Lyme disease can actually be transmitted sexually. And so if you get bitten by, you always should be careful with the people you sleep with. I mean, you should just not do the ADD thing and just give it a few months and see if they're normal and nice, or they're, I'm just a fan of being cautious. Another myth is people with ADD should just try harder. I know if I wasn't doing well in school, my dad would kick my butt and tell me to try harder, and it would work. But for people who have ADD, in fact, the harder they try, the worse it gets. So here's actually a very interesting scan of someone who's a mixed martial artist. And you can see he's got damage in his temporal lobes. But this is rest and this is concentration. So when he tries to concentrate, his brain shuts down rather than turns on. And on the right treatment, in fact, this one was just Focus and Energy, a supplement we make to help with focus, and Brain Power Basics. It's sort of our basic supplement, multiple vitamin, fish oil, brain boost. Awesome response. Another myth is everyone outgrows it by 12 or 13, and now we know half the people never outgrow it. They can be 94 and still have it, and still respond to treatment. So it's really never too late. So do you have ADD? So let's talk about it. I have a new show on public television called Healing ADD. It's great fun. I think maybe it's our best show ever as far as raising money for public television. Short attention span, but not for everything. It's short attention span for regular, routine, everyday things. Schoolwork, homework, paperwork, chores, the things that make life work. But for things that are new, novel, highly interesting, stimulating, or frightening, people with ADD can pay attention just fine. It's what fools everybody. It's like, well, I can pay attention if I'm interested. I mean, that's what teenagers go, I don't have ADD. How could I have ADD? I can pay attention for hours on car stereos. They're just getting D's and F's. They tend to be easily distracted, disorganized, poor follow-through, and they have issues saying things or doing things that they don't really think through. So, short attention span. So they need excitement in order to focus. Who would run with the bulls? I just don't get it. How is that a sign of intelligent life? But you can bet in this moment this ADD person is focused. They love scary movies. Why? Because they feel alive. I hate scary movies. Have you ever asked yourself why there's Saw to start with? But then it's Saw 2, 3, 4, 5, 6, and 3D. Why? What's sort of the purpose? And what these people will tell you is it makes them feel alive. I just like, what's the point? They like to race cars, very high incidence of ADD, and they love a good fight. In fact, in my book, Healing ADD, there's a chapter called The Games ADD People Play. And the first game they play is Let's Have a Problem. And so they pick on their partners. They pick on other people at work. They pick on themselves. And you notice they use negativity as a stimulant. So if they're not properly treated, if we don't fix their frontal lobes and stimulate their frontal lobes, they stimulate them themselves. And they'll do it by complaining, by whining, or by having a very high ANT population. So ANT stands for automatic negative thoughts, the thoughts that come into your mind automatically and ruin your day. And sometimes it'll get really dark and evil. I remember Betty many years ago. She'd come into my office. She had 5 children. And she would tell me the most awful ways she was going to kill herself. And I was like totally freaked out for her. And then it hit me one day, is Betty's not killing herself. Betty uses this as a stimulant. And so I told her, I said, you need to stop that. I said, you're stimulating yourself. She said, what do you mean? I said, you're no more going to kill yourself than I am. I said, you have 5 children. You know if you kill yourself, you've just increased the risk of them killing themselves. You love them. You use it so you can turn yourself on. And it was just like that aha moment that so many people who focus on negativity do it to treat an underlying ADD. But when you're married to someone who has ADD and you don't, it's chronic stress because you're like, why are you picking on me? We're on vacation. We're going to have a nice time. Why are you fighting? And they have no idea because it's not conscious. It's not will-driven. It's brain-driven. It's really interesting. Okay, so they're easily distracted. Noises bother them. They're sitting down to do their homework. The phone rings. It's not even for them. They go, oh, yeah, I have to call somebody. Or somebody opens the refrigerator. It's like, oh, I'm hungry. And so 10 minutes of homework may take them an hour and a half to do. They're sensitive to the environment. Tags bother them. Lights bother them. Sounds bother them. And there are more distractions now than ever. Yes, this is Liam. I mean, they're just in front of all these gadgets. They're disorganized. And think of rooms, desks, book bags, filing cabinets. They tend to be late. Even if they're ready early, they'll still be late because they'll go, oh, well, I can do this one thing that says 5 minutes, but it takes them 30 to do. So this is a guy who came to see me in Fairfield right after Change Your Brain, Change Your Life came out. His wife forced him to come see me under the threat of divorce. He's an emergency room doctor. Isn't that interesting? So we've seen 600 physicians as patients here at Amen Clinics. More than half of them have ADD, and they were mostly emergency room doctors. Why? Excitement. We've not seen one ADD dermatologist. There's no excitement in skin tags or rashes. And so he's in my office. He doesn't want to be there. His wife's threatened to divorce him. And I'm like, well, humor me. I said, how's your organization? He said, fine. And his wife is next to him, and she slugs him. She said, why are you lying to Dr. Amen? And she sent me this picture later. This is his definition of an organized office. The overfocused ADD people, we'll talk about that in a minute. They have islands of organization. So you go in some parts of their house, they're perfect. And other parts of their house, it's a disaster. Poor follow through. They don't do anything until people are mad at them. It's like somebody has to be angry at them in order for them to get things done. Isn't that sort of crazy? But they've known about a term paper for 3 months, and it's the night before, and they're like, oh, I got to get this done. So everything is the last minute. And it's almost like, if somebody's not mad at you, it won't happen. But you see the stress that not only causes you, it actually causes other people in your life. And impulse control issues. They often don't think before they say things, think before they do things, and it gets them into all sorts of hot water. So we typically see low activity in the front part of the brain, and also this is the cerebellum we were talking about. But the front part of the brain is the brain's supervisor. It watches you, forethought, judgment, planning, impulse control. And when they try to concentrate, it drops. So the harder they try, the worse it gets. So how do we heal this? So know if your loved one has it, and I know I've made some of you feel uncomfortable, and I apologize for that. Know your type. It's not one thing. I think that's sort of the big revolution we've caused at Amen clinics. ADD is just not one thing. When you start looking at people's brains, you realize it's a whole bunch of different things. Targeted supplements or medicines. You got to get your diet right. So I was talking to this girl today. She does the paleo diet, which is really great for some of the types and really bad for other of the types. The right behavioral strategies. And you got to get your family involved, because if you have it, odds are you got it from somebody. And holiday dinners can be very interesting in ADD households. So I actually keep a journal of what people tell me after I treat them. And I love this one. My husband said he doesn't have a knot in his stomach anymore. We're closer than ever. Untreated ADD causes relationship problems. Able to handle situations where I used to be hysterical. I used to think I was stupid. It seemed everyone else could do more than me. I'm starting to believe there may be intelligent life in my body. Now, this is really important. Girls often don't get diagnosed. And then what happens is they chronically underachieve. And then they have a child, a little boy, who's a hellion. And the little boy gets brought to the Amen clinics, and as soon as we see a child that has it, we're looking around to see where it come from. Because it almost always comes from somewhere, unless there's a head injury or infection or anoxia. And so we'll often find it in the mom. And so the mom may be 35. She never knew she had ADD. She just tried and it didn't work. Son gets diagnosed. She gets diagnosed. The treatment works for her, and then she gets depressed. Why? Because she begins to mourn the loss of what could have been. So it's a very important dynamic. If you're not diagnosed first until you're 35 or 45 or even 60, you begin to wonder, what would my life have been like if I could concentrate? So the actual quote for this, I edited this for TV, is I used to be the kind of person who would walk in downtown Detroit at 2 o'clock in the morning. Now, I'd never do something so stupid. Before, I just wouldn't think about the consequences. And I try to plant these two little words in all of my patients, then what? If I do this, then what happens? If I say this, then what happens? Get them not to react to the moment, but get them to react to all the moments. So, what we do at Amen Clinics that I'm so proud of is brain imaging. We look at people's brains because how the heck do I know what's going on with you unless I look? Most psychiatrists still today, it's sort of a scandal really, they never look at what they do before they do it. Our diagnostic Bible, the DSM-5, is a symptom cluster driven diagnostic system. So if you meet 6 out of 9 of these symptoms, you have depression, or you have bipolar disorder, or you have schizophrenia, or you have ADD. And we are the only medical specialty that acts like that. That's diagnoses are based on symptoms, not on any underlying physiology. Well, in 1991, when we were in Fairfield, I went to a lecture on brain SPECT imaging, and it radically changed my life. I went, you mean I can look? And yes, I got a lot of grief from my colleagues, but I'm a middle child, I'm a little bit of a maverick. If you don't like me, I don't really care that much. And I was a psychiatrist for nearly a decade before I ordered imaging. I always felt like I was guessing. You know, it's that, what's the word, Brad? There's a word for this, like you're guessing, or you're a fraud, or you're not. I always felt like, how the hell do I know what's really going on with you? I'm sorry? An imposter. Yeah. Like, I had a violent teenager, you know, he just lit off a bomb at school. Now, how do I know he's going to do it again? I have no idea. And I feel like I'm handicapped. And now I start looking, and patients get better faster. And that's always what makes me excited. So SPECT is a study that looks at blood flow and activity. It's real easy to understand because it basically tells you 3 things. You can see good activity, too little, or too much. That's it. So healthy activity, low activity, high activity. And then once we see your brain, our job is to balance it. And so here is a healthy scan, both of these. This is looking underneath the brain. We call this our surface scan, and we just want it to be full, even, and symmetrical. Here's the back bottom, here's the front, these are the temporal lobes. All you want it to see is full, even, and symmetrical. In this view, blue is average activity, red is the top 15%, and should be here in the back in the cerebellum. Why? The cerebellum has half of your brain's neurons. So one would think that's probably important, right? If 10% of your brain contains half of your brain's neurons, maybe we should be thinking about this part a little more than we do. Because virtually in psychiatry, you never hear about the cerebellum. So one of our important early lessons, I mean, we learned this the first 6 months. Oh, ADD is not one thing in the brain. Anxiety, depression's not one thing in the brain. Maybe this is why you give some people Ritalin. It's a miracle. They go from D's and F's to A's and B's, and it's awesome. And other people who had exactly the same symptom cluster, put them on Ritalin, now they want to kill people, or they want to kill themselves, or they become obsessive. And what we saw, they had different patterns in the brain. So, for example, 2 people with ADD, one has really low overall activity and one has really high activity. Do you think they'll both respond to the same medication? Of course not. So I'm getting really excited about this. I have more information to help me make better diagnoses. And my patients get better faster, and that's what really built Amen Clinics. We went from this little tiny clinic, now we have 6 clinics. We actually have 4,000 patient visits a month. We're busy. Why? Because it works. And what I discovered over time is there are actually 7 different types. And when you look at combinations of types, there's a whole bunch of them. That it's complicated. But I'm going to try and make it as simple as I can for you tonight. There are a couple of neurotransmitters that we hypothesize that are involved, like dopamine. That's what all the stimulants work on. Dopamine is involved in focus and motivation. It stimulates the brain, and then there's serotonin, which is involved with mood, sleep, and shifting attention. And then GABA, which calms the brain. So the first type is what you'll classically think of as ADD. Short attention span, distractibility, restlessness, impulse control. And we usually see low activity in the front part of the brain and typically in the cerebellum. That gets worse when they try to concentrate. So that's why we call it classic ADD. And Sally's my first patient. So it's April 1991. I just go to this lecture. It's in the morning, and I walk out of the lecture into Sally's room. So Sally's a new patient for me. She's 40 years old. She has an IQ of 144. She tried to kill herself the night before, impulsively after she had a fight with her husband where she picked on him. And as I start talking to her, I think she has ADD. Right? I'm a child psychiatrist who sees adults, so I know a lot about ADD. She had an 8-year-old son that has ADD, and I went, this is the best question to ask adults about ADD, is if they're in school or they were in school, how did you study? She said, well, I never really studied. And if I did, it would be the night before an exam. I'd come home from a date. It'd be 11 o'clock at night. I'd put on a pot of coffee, stay up all night, pass the exam. That's sort of how I did school. I said, classic ADD. I start talking to her about it. I don't think I need the scanner, but she blocks me. She's like, no, adults can't have ADD. And I'm thinking to myself, I know more about this than you do. But I inhibit my first thought. And I said, well, I have this new study. Can I look at your brain? And she's like, okay. All our patients want to look at their brain, right? I mean, it's like, please, more information. Don't just believe what I tell you and make a diagnosis that's going to change the rest of my life based on what I told you. Patients don't trust psychiatrists, and I totally get why, because we don't act like physicians. So I go, we have this new study, what do you think? She's like, let's do it. And I knew I should do it twice, once at rest, once when she concentrated, for some other work we'd been doing. And so this is Sally's brain at rest. Not too bad, actually looks pretty normal. And when she tries to concentrate, she gets decreased activity in the front part of her brain. And then when I got the pictures back, I put them down on the table in her hospital room. I showed them to her, and she starts to cry. And she said, you mean it's not my fault? And I wear glasses to drive, and I took my glasses, put them on my face, and I said, it's not your fault. Having ADD is just like people who need glasses. You know, people need glasses aren't dumb, crazy, or stupid. Our eyeballs are shaped funny, and we wear glasses to focus. People have ADD aren't dumb, crazy, or stupid. Their frontal lobes turn off when they should turn on, and you need help focusing. She immediately got it, immediately decreased shame, decreased the self-loathing she had, decreased stigma, increased compliance. She took the medicine. She's radically better. I followed her for 8 years. Her marriage was better. Relationship with her child was better. She wasn't trying to kill herself. I mean, there was just a lot less drama, which I think is probably good for developing children. Don't you think, to have a lot less drama between their parents? So, classic ADD, what we do is we try to boost dopamine. You can do it with stimulating supplements or medication, exercise, a high-protein, low-carbohydrate diet, omega-3 fatty acids, but not DHA. DHA calms the brain. EPA stimulates the brain. So this works, like, I don't know, 9.5 times out of 10. They get a radically positive response when you get the type right. The next type is what we call inattentive ADD, where they have, it seems like almost low overall activity. They have trouble focusing. They're not hyperactive or impulsive. They tend to be more introverted, more common in girls. They don't have behavior problems, so they don't get recognized until later. I mean, the little boy who's going around punching other people, he's in the doctor's office early. The little space cadet, he may not ever be in the doctor's office, and they just may label him as dumb. or unmotivated or doesn't care. So they have low prefrontal cortex, low activity overall. And so, so I have 4 children, and Brianne is my oldest girl, so she's the second one. And she's the one I was closest to when she was growing up. We're like this. Her little sister, she was a hellion, right? Trying to hold Caitlin when she was a year old was like trying to hold a live salmon. It was hard to be close to her because she was always trying to get away. But Brianne, we're like this. But the truth is, and it hurts my feelings when I say this, is I never thought she was smart. I had to teach her things over and over. Always sweet, always tried. And in 3rd grade, I sent her to a neuropsychologist to test her. And the psychologist said, she's not that smart. Now, she didn't say it like that, but that's what she said. And she said, but Brianne would be okay because she works so hard. In 8th grade, Brianne won a Presidential Scholar Award, not for academics, but for effort. You know, I mean, you just love this child. But in 10th grade, she fell apart. She was at Justin Siena in the Napa Valley. She's in a college prep school. She's working her brains out. It's not working. And she's coming home crying. And I remember one night, she's studying genetics, had no idea what was going on. And she started crying and telling me that she could never be as smart as her friends. And it just broke my heart. It was 1997. And so in 1991, when I started doing the imaging, I scanned everybody I knew. I scanned my kids, I scanned my mother, I scanned my crazy aunt, I scanned myself. And so when I really see Brianne in pain, I go back and I look at her original scan. Because in 1991, I had the eyes of somebody who'd seen 50 scans. Now, by 1997, I'd seen 5,000. So I had a much better idea of what I was looking at. And when I looked at her scan, it was overall really low in activity. I was horrified. And so I had her get another scan, and that was her scan. It's terrible for a 15-year-old. And I'm like, oh my God. I mean, I cried when I saw it. Because I'm helping all these people. And someone I'm really close to is suffering. And so the next day I scanned her again on a little bit of medication. And I'm like, whoa, I can make her brain better. And she was initially resistant to the idea of medicine because her little sister had been on medicine since she was 4. And they were at war, so it's like, I'm not like Caitlin. But when she took it, she felt so much better. She's like, you're going to give me this stuff, aren't you? And a week later, she and I had dinner together. And she's looking. I'm like, so how's it going? She said, I'm going to be a geneticist. I'm like, what did you say? She said, well, it's the future, don't you think? She said, since you gave me the medicine, I can actually see the DNA double helix molecule rotate in my head. 3 months later, straight A's. The next 10 years, straight A's. She got into the University of Edinburgh's vet school, which is the best veterinarian school in the world. Now, imagine where she would be if I wouldn't have figured this out. That we would have condemned her to a life of mediocrity and thinking that she was less than. Happens to way too many people. So we treat this by boosting dopamine. High protein diet, stimulating supplements or medicines, exercise, and it's awesome how it works. I mean, it's just awesome. But there's this other really interesting type we call overfocused ADD, where their problem is not that they can't pay attention, they can't shift their attention. So there's a difference. In order to pay attention, you have to be able to track. And in order to track, you have to shift. from this thought to that thought, and so on. So these people have trouble shifting attention. So they have too much activity in the middle part of their frontal lobe called the cingulate gyrus. They get stuck in loops of thought. They have both low serotonin and dopamine. So this is such an interesting part of the brain. And before I did imaging, I had no clue about it. And I don't know, in the last 15 years, it's become really a star in neuroscience because it's the brain's gear shifter. Go from task to task, move from idea to idea, be flexible, go with the flow. And this part right here is involved in error detection. So what does that mean? It sees when things aren't right. And if it works too hard, it's always focusing on the things that you don't like about yourself, about your spouse. So women have a busier anterior cingulate, and they have many more body image issues than males do. So my wife, who is beautiful, will look in the mirror and see everything that's not right, and I'll look in the mirror and go, how could you keep your hands off me? I just don't understand it. So overfocused ADD, they have all the ADD things that we talked about, short attention span, distractibility. These are the ones that have that erratic organization. Some places really organized, some places not organized. They worry, they hold grudges. But notice, this is all they get stuck. Things don't go their way, they get upset. Oh my God. On the surface, they can appear selfish, but they're really not selfish. What they are is rigid. They're inflexible. They tend to be argumentative and oppositional. No matter what it is you say to them, they argue with you. It's a nice day today. Well, it's not that nice. It was nicer yesterday. I mean, just that's their automatic response. Does anybody know somebody like this?
Oh, yeah. I see her every day.
And there are too many errors in themselves, in children, in their spouse, in their boss. Complain on and on. And family members also get stuck. So holiday dinners for these people are really interesting. Now, what if you have an ADD couple where one is classic and one is overfocused? So this is actually my first couple scan that I did. It was back in 1991. These people hated each other. But the imaging made a huge difference because I calmed her brain down, stimulated his, and they're still married 20 years later. So we treat this by medications or supplements that boost both serotonin and dopamine. Do not do well on a high-protein diet. These are people you put on the Atkins diet, they get mean. So you put somebody on the wrong diet, you can actually get divorced. This next type is called temporal lobe ADD. So here are your temporal lobes, very important structures. They're involved with mood stability, memory, learning. So these people have all the temporal lobe symptoms, the ADD symptoms, plus learning, memory, temper problems. And my first case, which was like May 1991, is Chris. So Chris had been diagnosed with ADD when he was 6, put on Ritalin and started to hallucinate. So he had a really bad response. And then he attacks a boy at school when he's 9. And Kim, can you get me some water? They put him on dizipramine, antidepressant. It doesn't work. And now he's in psychotherapy for years. And at the age of 12, he attacks a boy at school and ends up in the psychiatric hospital unit by random chance on a weekend when I'm on call. And when I first met Chris, he was just a little shit. I don't know. How else do you say that? I mean, he was nasty to people and aggressive. On the weekends, when I'm on call, I get all the kids on the ward. We play touch football together. He cheats every single play. And I remember he took the ball and moved it when you shouldn't have moved the ball. And then he turned around and looked at me like, what are you going to do? Yell at me like my mother yells at me? And I thought to myself, I'm not going to yell at you. I'm going to scan your little brain and find out why you're like this. Thank you. When we scanned him, he had really low activity, but especially in his temporal lobes. More so on the left than on the right. Left-sided temporal lobe problems are associated with violence. We've now actually done murderers, we've done 90 murderers, we've done serial killers, we've done mass killers, left temporal lobe. It's just a bad place in your brain to hurt. And so I actually had no idea what that meant on SPECT scans. And so I went to the literature. And in the literature at the time, you actually had to go to the library as opposed to just break out your phone. And low activity in the temporal lobes on SPECT is associated with seizure activity. So I put Christopher on Tegretol. Tegretol is a really good anticonvulsant. And no lie, within a week, he's the nicest kid on the ward. He's still struggling in school. I realize he's got low frontal lobe activity. I then put him on something with ADD. Notice the order. First the anticonvulsant, then the stimulant. And he just did awesome. I mean, like, really awesome. In fact, sort of the cool part of the story is when I first saw Chris, they were seeing a psychoanalyst, and the analyst was always harassing the mother to get help. If only you got help and fixed your childhood issues, this kid wouldn't be struggling so much. As Chris got better, the mother didn't look so bad. Now he's getting straight A's at school, and 5 years later, they invited me to speak at his high school. Because I did that a lot. And when I walked onto his campus, I saw Chris, and he recognized me, came over, ran, gave me a big hug. And it was just one of those moments where if I wouldn't have figured this out for him, what do you think would have happened to that boy? Is he'd have been in juvenile hall, or he'd been in residential treatment, or he'd have killed someone, or he'd have killed himself. And what would have happened to his mother? People always, they focus on the cost of the scan as opposed on what is the cost of having ineffectively working brains. That's what's expensive. The little bit of money you pay for the scans is not expensive when you compare it to the life costs. So this type will use medications or supplements to boost GABA, stabilize the temporal lobes, then something to boost dopamine in that order. They also do better on a higher protein, healthy fat diet. Okay. This is in, again, because in the show, my wife, who's lovely and sweet, but a little nuts, actually, she thinks if you do something bad, they should kill you. I mean, I married my father. She's cuter than my father, but that was, kill the bastard. I heard that all the time growing up. And when we got married, and my wife grew up in a frightening home. Her uncle was killed in a drug deal gone wrong when she was little. So you can sort of understand why. And but on our show, she said, and if you're noticing people are acting badly, somebody should look at their brain because it may not be their fault. And when I'm writing the show, I'm like, are you sure you want to say that, like in public? I thought it was beautiful. I've softened her. I've had influence over her. All right, the next type, we call it limbic ADD. Their emotional brain works too hard. They tend to be sad, negative. The glass is half empty. Lousy appetite, and they're more socially isolated. With this type, I love SAMe or Wellbutrin. And then the thing I'm sort of known for is what we call the ring of fire, where their brain is not low in activity, it's high in activity. And when I was seeing all these ring of fire scans, I'm like, please don't give them a stimulant, because 8 times out of 10, if you give them a stimulant, you'll make them worse. They're moody, easily distracted, too many thoughts, overly sensitive to light, sound, and touch. Jarrett's a great example. Nobody wanted to play with him. He's a good-looking boy, but he was mean and had a terrible temper. He caused a lot of strife in his family, socially isolated, because nobody wants to play with him. We scan him. He's got the ring. We actually make a supplement called Neuralink, boosts GABA and serotonin and dopamine all in the same thing. So it's this beautiful balancing brain. And he's now 3 years on the honor roll and the sweetest kid you can imagine. He was on every single stimulant. And I'm like, after they failed 2 of them, somebody should be trying something else. Otherwise, the doctors have learning disabilities, right? If you don't figure this out quickly, you hurt people. Maybe it's early bipolar disorder. It could be an allergy, or it could be an infection. We'll often see infections early on is too much activity in the brain, and so it may look like inflammation. So we'll put them on an elimination diet. I actually think every ADD child or adult should go on a month-long elimination diet and go, does it help you or not? But not do it in the ADD way, which is sort of maybe half-assed, but to really do it. I mean, to be serious about it. No dairy products, no wheat, no corn, no soy. And best testimonials we have at Avon Clinics is our corporate nutritionist, is really putting people on an elimination diet. They did it in 2 studies in Holland. They basically found it had the same effectiveness as Ritalin. Isn't that interesting? Means our food is poisoning us. And then the last type, I added this in my new book, and the reason I did is because it's just so stinking common to be both anxious and ADD. So they're anxious, nervous, tense. They predict the worst. They bite their fingers. So they have the ADD symptoms plus the anxiety symptoms. And we do a lot of relaxation things, but we do GABA and dopamine. Stimulants alone usually make them worse. And so here are the types. So classic, think of the hyperactive, restless, impulsive person who can't concentrate. They do really well with stimulants. Inattentive, so the introverted space cadet, also do well with stimulants. And then the overfocused, worried, rigid, inflexible, oppositional, argumentative. Stimulants usually make them more obsessive. They need both serotonin and dopamine. The temporal lobes, and this may come from a head injury or you come from a family of violent people, they need an anticonvulsant. And without that sort of mood stabilization, they're a mess. Limbic, which looks sad. Ring of fire, they're all over the place. And anxious. So it's not that hard, but when you really understand it this way, people get better so much faster. And then, you know why Ritalin has a bad reputation? Not that it's a bad drug. It's a great drug for the right person. And it's a nightmare for the wrong person. But the same thing goes with Prozac. And the same thing goes with all of our medications. And I think a trend in psychiatry, a really important trend in psychiatry, is away from medicine to natural treatments. Why? Because patients are freaked out. All of our medications have black box warnings. How many of you want to take something that has a black box warning? This medication could kill you. You want to do that?
I'd like to ask a question. Given the prevalence of the use of alcohol in our society, if you gave any of those brains 2 shots of vodka,
It's a very interesting question because for a number of legal cases, we've actually gotten people drunk. And when you get drunk, that's usually more than 2 shots, you really crash their brain. They're really low activity. But if they're an alcoholic and they're in withdrawal, and you give them 2 shots, it actually makes their brain look more normal. For most people, alcohol decreases frontal lobe and cerebellar function, which is why you have trouble walking a straight line or inhibiting what you say to the police officer as he stops you. So I want to tell you this little story, and then I'm happy to answer questions. So I did this big project at Saddleback Church. So Saddleback is one of the largest churches in the world, And about 4 years ago, Pastor Warren, you may know Rick Warren. He wrote The Purpose-Driven Life, sold 36 million copies. He's our generation's best-selling nonfiction author. And Pastor Warren had seen me on TV talking about something called the dinosaur syndrome. There are 200 studies now that say as your weight goes up, the actual physical size and function of your brain goes down, which would just scare the fat off anyone. And so I was talking about it on public television, you know, big body, little brain, you're going to become extinct. And so I call it the dinosaur syndrome. And, you know, with 2/3 of us overweight, 1/3 of us obese, it's the biggest brain drain in the history of the United States. And so one Sunday in August 2010, he was baptizing 850 people. And about halfway through, he realizes everybody's fat. And he's like, and I'm fat. And he's like, will you help me? I don't want to be a dinosaur. He said, I'm not getting healthy for my heart because I don't care. And to live longer, I'm going to heaven. I don't really care about that either. And to be sexier, he said, look at me, I'm already sexy. He said, but when I heard you say, as your weight goes up, the size of your brain goes down, now you have me because I don't want to be stupid. And so I put together a health plan with my friend Mark Hyman for Saddleback Church, and we launched it January 15th, 2011. 15,000 people signed up, and over the next year they lost 250,000 pounds. Well, we have now, and around here somewhere is my book, The Daniel Plan. It has been an international bestseller, and our goal is really to get it to 1 billion people across the globe. But I learned something very important doing the Daniel Plan, is that first, if something afflicts you, you have to get the information. So you have to get it personally. And then you have to teach someone else about it, because it really is in the act of giving that you receive. And that's how we begin to change our society. Get it, give it away, keep it forever, change the world. And so Lori is just a great example of it. Lori is she was the director of the Salvation Army's largest drug treatment program in Anaheim. They had a 185-bed treatment facility. And she falls in love with my work. She comes to all my lectures and workshops. And she's like, I just love this. And what she realized is as she wanted to learn about brain health, that she developed brain envy, so she cared. And then she realized, oh my God, I've got to get physically healthy, because if I don't get physically healthy, my brain doesn't work. Your brain is an organ just like any other organ in your body. And so she took one of the courses we gave, ended up losing 60 pounds, and she's only like 4'11". So that's a lot of weight for her, but also lost her IBS and her brain fog and her pain. So she's thinking clearly. And then what she did is she's drinking a green drink with her grandson. So now she's giving it away to her family. Her husband's better, kids better, grandkids are better. That's exciting, right? And then what she did is she planted it in the Salvation Army's largest drug treatment program with a lot of grief from her superiors. Because when you go in to change a system, there are a lot of no people. No. A lot of cingulate people, right? Who, if things aren't their way, it doesn't exist, who will fight with you, they're automatically oppositional and argumentative. And my experience with the Salvation Army is they're the most unhealthy group of people I've ever met. So if they're ringing the bell and they want your $5, you want to go, are you going to spend this on healthy food or unhealthy food? One of the big ahas when I was at Saddleback, and we started, Saddleback feeds thousands of people every week. Crap. And I'm like, no. It's like, no, we can't do that. We want to give away healthy food. Calorie restriction is associated with longevity, right? Eating high glycemic, low fiber foods like fast food is associated with early death. Are we going to have a mission of love, or do you think of yourselves as the angel of death? Anyways, so as she planted, these are all court-ordered criminals into the Salvation Army's. And we practice our show, Healing ADD, in front of these guys. And so before the talk, I went, how many of you think you had ADD growing up? And it was about 30% of them. And after the talk, it was 80% of them. When they went, oh my God, that's me. And so here's William. And William had actually been diagnosed as ADD. He was overweight, he had been in jail, he was a drug abuser. And when he ate right and exercised and learned his type, he lost 80 pounds. And he said, my mind is clearer and faster. And then my favorite story in this was Thomas, who was a gang member who had been in prison. This was like his 6th try at treatment. And treatment centers, I don't know, Rick, what do you think? Do they feed them well or not that well? They don't even think about it. Isn't it crazy? So he's in prison, he failed his GED, and now he gets on the program about brain health. He loses 85 pounds. He passes the GED. His mind is clear. And at the end of the program, he wrote Tana, my wife, and I, this letter. And he closed it with, my life was a mess. Now it is a message. I have been tested. Now I have a testimony. I was a victim. Now I am victorious. I went through trials. Now I am triumphant. You are not stuck with the brain you have. We can make it better, and we've proved it. We've actually published studies on our outcomes. Our outcomes at Amen Clinics are better than anywhere that publishes outcomes. So if you come here, you're probably complicated, right, Brad? I mean, Brad's seen hundreds of our patients, maybe more. And on average, patients who come have 4.2 diagnoses. They have failed 3.3 providers and 4 to 6 medications. We do a formal outcome study on everybody we see. At the end of 6 months, 77% of our patients are better across all measures. 85% their quality of life is up. We're really excited about that. We published another study that if you get a scan, it changes what your doctor does 8 times out of 10. Isn't that interesting? You see head injuries you never knew were there. You see toxic exposure you didn't know was there. I mean, how many times have we seen teenagers and their brain looks toxic, and their parents swear they never did drugs. The teenager said he never did drugs, and when you show them their toxic brain, they're like, well, I only drink a little. And I only smoke pot every once in a while. And then when you really understand it, they're drinking a lot and they're smoking a lot of pot. Isn't that interesting? So the scans uncover information that you can't tell by asking questions about symptoms. Think about that. I mean, as a whole profession, we make diagnoses based on symptom clusters. Symptoms will never tell you if your brain is low in activity or high in activity, if it's toxic or traumatic. And so it's really, it's why Dr. Stoller works here. We have to think about integrative medicine. I see a toxic brain. Well, is it mold? Is it Lyme? Is it, what? I saw this one guy, they came for marital counseling. And they'd failed 5 marital counselors. And I'm like, oh, good, one of our patients. They failed all these people. And her brain looks fine, and his just looks like he's a long-term drug addict. And I'm like, and in his paperwork, because you do a long history if you come here, it's like, never did drugs and doesn't drink. Now, what's the first thing you learn about drug addicts? They lie. And so right in front of his wife, one of my first questions to him is, are you sure you don't drink or do drugs? He's like, Dr. Amen, I have many problems. That's not it. Then I looked to his wife and I said, is that true? And she said, oh, yes, Dr. Amen, he doesn't drink. He's never done drugs. He's just an asshole. And I sort of chuckled to myself when she said that. But then my brain went, why does his brain look so bad? And so I did a differential diagnosis. Drugs, alcohol? Well, probably not if the wife who doesn't like you is saying you're not an addict. Well, it could be anoxia, an infection, an environmental toxin. My next question to him is, where do you work? He said, I work in a furniture factory. I said, what do you do? He said, I finish furniture all day long. I said, do you wear a mask? He said, no, they tell me I should, but I don't. And then I looked to his wife and said, so when did he become an asshole? She said, what do you mean? I said, did you marry him that way? Do you have father issues you're trying to work out? She said, no, he was great when we got married. It wasn't until about 5 years ago. And then she put her hand over her mouth and said, oh my God, that's the time he started working at the furniture factory that his behavior started to change. Do you think it has anything to do with it? Now, do you think more marital therapy is the answer for him? Or is it brain rehabilitation? Easy to call him an asshole, right? And you know, as mental health professionals, we have our ways of calling people assholes, right? Narcissistic, antisocial, borderline, and we can get paid for calling you an asshole. But I haven't given someone a personality disorder diagnosis in a very long time because I just don't think they're helpful. How is that helpful to call you a bad name when I'm trying to help you? Those diagnoses put barriers up between the person and the professional. And so it's about rehabilitation. And the exciting thing is you are not stuck with the brain you have. You can make it better. And I'm always saying, how do you know unless you look? Right? It's easy to say that the kid in Santa Barbara who murdered those people and then killed himself is a bad person. The harder question is why? What happened? All the school shooters, virtually all of them, had seen psychiatrists or had been seeing psychiatrists. Think of James Holmes, the Batman killer in Colorado. His psychiatrist didn't want to see him anymore. Of course, if you don't have imaging, you often don't have hope. Imaging, just for me, in the last 23 years has changed everything.